Dear viewers, welcome to the Miind My Miind talk show. It's great to have Jas Bhatia again on our show to talk more about mental health and on a very, very interesting topic. Is the pandemic over? What is the perspective from a mental health point of view? I think this is a very, very important aspect which has been much ignored during the pandemic. I personally feel that while the pandemic might be over, but there is another pandemic that still looms, which is the mental health, which we have ignored while trying to take care of our physical bodies. Let's get Jas's perspective on this. So Jas, what is your view on is the pandemic over or not?
Well, I think, first of all, the pandemic isn't over. It is a break, like the cliched way of saying it's the bend and not the end. It definitely seems to be waning, but it isn't over till it isn't over. So I think that false sense of optimism is just deteriorating the mental health further. I remember when that came in and we had the first lockdown, we were talking, all our fellow trainers and psychologists, we were having a conversation about the same thing, that it's a 6-month thing and let's plan ahead. And at that point in time, I told them, no, it's not a 6-month thing. By definition, pandemic is 3.5 years. So if WHO is declaring a pandemic, the bigger concern, Gurit, is, as you just said yourself, the pandemic of mental health issues that's coming in. More or less, like we used to talk about motivation, remember back in the pre-days?
Right.
We used to talk about people being demotivated, whether you look at corporate employees or you look at your life. People used to ask me that very often, that, oh, you know what, getting up in the morning is an effort. How do you motivate yourself to get up in the morning? And if you now look at it, it's a very middle way of the street. I call it the middle child of mental health. Which is now being born. It's called feeling languished. So that emoji that we have in the social media, which says "may," that "may" is becoming the new order. People aren't excited, but people are not depressed. They are kind of suspended, hanging somewhere in between. And that's worse, because mental health is awareness of where we stand. Our awareness of our well-being or ill-being is what mental health is.
I think you very beautifully stated, and I think even I can relate to it. I'm sure a lot of people who are hearing us would also be able to relate to it. What I call it as the suspended state. Right? So you're not really sure where you stand in your head. On one aspect, the fear factor that's set in for lives, when especially during the wave 1, we saw incessant deaths, we saw severe shortage of beds in the hospitals, etc. Followed by the wave 2, where somewhat the story repeated itself once again, and by then the effects of the medications of wave 1 kicked in. Things just kind of getting more gloomier and gloomier, and added to that the economic scenario, which wasn't very comforting at all. When you're looking at a lot of people lost their jobs, even people in care lost their jobs, unfortunately, when they were required the most. I think it has had a very deep effect. But the other side of the safety precautions that all of us took, where we all were socially marooned, socially isolated, and especially, when you fall ill, you want somebody to hold your hand, or, in situations of stress and distress, you want your close families and friends around. You were completely cut off. So I think what you say is a very beautifully put this thing. But I think it's time that we kind of look at it, especially with the government statistics now coming in, that most people around us suffer from some concern or the other. You see, people confuse mental health with, it has a connotation of being kind of, being not okay in your head, but it's not.
You're being kind when you say, people straight away tell me, "मैं पागल थोड़ी हूँ."
Exactly. It's not about
that's how it is.
Yeah. It is about being mentally well, mentally present, motivated, like you put it.
I think it is that also. It is about knowing where you are. Like, let me quote Alice in Wonderland, or let me quote the cat in Alice in Wonderland, who said that, "Where are you going?" And Alice says, "I don't know." Well, if you don't know where you're going, then it doesn't even matter why you're asking the directions. So it's very important to take an inventory of where I am today. That's how everything in the world gets set, right? You have to buy something, you go on Amazon and buy it. We had to do this today. We get on Zoom and do it. So everything will begin with just where are you? But if I say, I don't know where am I, then what am I going to do in life? But somehow with mental health, people don't think like that. Well, it's changing. It's definitely changing. People like yourself, the kind of organizations that are getting set up, the kind of support that you're providing, we did not have this kind of support 10 years earlier. So things are definitely changing, but it's just is very slow. The amount of memberships that go to the gym, people need to follow up. More than 80% of the people pay up for the annual membership but don't go to the gym. There is definitely a mental component here which people are ignoring. Absolutely. So how about getting this right? When this gets right, this naturally supports.
Absolutely. So tell me, just incidentally, July also happens to be a month for social wellness. So, interestingly, we also picked this topic to talk about on today. How has social isolation impacted us, during the last 2 years?
Many won't agree, but I'll say in one word: horrible. We are social beings. And you so beautifully said yourself a while ago that you need your loved ones. And this is the time wherein we could not have people. I think, Guri, the time that got presented to us was such an amazing opportunity to come back to family, to come back to community. We can do everything over the internet, from ordering food to ordering dresses to even watching the OTT and getting emotional over that. But I think the real connection and the effort, or let me put it like that, the courage to try out your own people once again, is really required. So this social isolation will not do us good, is not doing good to us. The mental health is so impacted. People are not able to process grief. Go back to younger days. How was grief processed? Grief was always processed in a sabha. Nobody left that person alone. Now what do people say? Leave me alone. I don't want to talk to you right now. No. It needs to be processed with people. That's how we have the rituals. That's why we have ikat. That's why people come together. These things are essential, and it's community health.
Absolutely. Absolutely. And, picking up from the word community, I think that definition itself has changed, not by just COVID, but because of the behaviors that COVID has induced in us. How do we bring it back to normal?
I think the first thing to take care of is to get rid of the fear, or to make fear manageable. If you look at the way we have evolved, fear has always been a warning mechanism for us. Now fear is turning into freeze, which is making us stuck and we don't know what to do. So we got to go back a couple of steps and make that into a warning mechanism once again, rather than being stuck by it. And fear is natural and fear is great. That's how we save ourselves. But overdoing of something has led to this point that regular release of any kind of stress is very important. Anything which is not making me perform to the level that I want to, whether I'm a housewife or a CEO, I need to address it there and then. Kill the monster while it is young.
So very
And let's start.
Very interestingly, you have mentioned fear, which leads to stress, which leads to anxiety. And we spoke about it in the same breath, you know. So how interconnected and how related are these? In fact, you know, there are other manifestations also. A short while ago, I was with a child who used to have motion sickness as a little kid. And as the kid grew into an adult, the kid got over motion sickness. And guess what? Now, post-COVID, the motion sickness is back. And
yeah.
I found the child literally, wondering as to how could COVID push me back into something which I had actually overcome. So
it's the anchoring, right? It's the conditioning. So when you feel that same amount of fear or anxiety, well, depending on what the case was, it all comes back. It's like the moment you go down the aisle of your university, you remember all the mischief that you did in college, though you passed out some 30 years ago. So it's the same thing. The mind is so powerful that when you get that intense feeling, it just brings the same experience back.
Absolutely. Absolutely. So how do we, how do we start working on these aspects which have pushed us back? How do we come back to the normalcy that we were used to pre-pandemic? Because if we do not, we will see another pandemic in a very different and a very sad form.
First thing is to know that there is no going back. So there is no normalcy anymore. It's like a new benchmark for normalcy that is getting set. And it is great in its own way. I would say that if you haven't lost your people in the pandemic, you're really blessed. That's the first aspect of it. Now, to encash on that being blessed, and people who've lost are also more aware of the value of life in human beings now. And nothing ever can compensate for the loss of a loved one. And at the same time, we all know that the show must go on. So the first and the foremost thing is awareness. Am I aware of it? Like, you look at yourself, the way you do these small talks with the little talks with various psychologists. The idea is awareness. If I'm aware of where I am, again, I'll go back to the same thing. I can do something about it. Reach out, take professional help. There is no taboo. When I get ill, don't I go to a doctor? It's so easy to go to a doctor saying I have fever after I've taken Dolo and it has not come down. There is no taboo around that. But booking yourself a session with a psychologist or a therapist or a counselor, I mean, what about that? Also looking at the
different as going and seeing a medical doctor, ideally.
Say that again, sorry?
I said it's nothing different from seeing a doctor, for a fever. And I think that's the first fear that needs to be
exactly. That's what I'm saying. If I have something related to the heart, my heart is racing, I don't know what's happening, I rush to a cardiologist. It's natural. If I think something's off, I get my blood test done. I don't say nahi kisi ko batana nahi maine blood test nahi karwaya. Maine blood test karwaya. It's very natural. The other thing is, and I think we'll kind of put a stop after this, is knowing that uncertainty is part of life. We had made our lives very certain and secure. The coming in of COVID-19 told us that, you don't know what's going to happen in the future. So you can prepare for the worst and live in the present. That's very, very important.
And I think I would put that in one word. It's most as resilience, as mental resilience. I think it is very, very critical for all of us to build up to that now.
Yep, it is. And that's going to be our topic the next time. You remember that, right? We will be looking at mental resilience. So everybody who's watching us, be back. We will update you with when we are doing it. And it is mental resilience. Yes.
Awesome. Awesome.
Yeah.
Thank you, everyone. Thanks for being here and listening to us. Look forward and tune in for our next talk, which is going to be on mental resilience and how do we build it. Thank you so much, Gus. Thank you very much for being part of this show. Thank you. Bye-bye.